Hello, this is Dr. Boyce. I'm a board-certified bariatric surgeon, and patients often have questions about their bariatric surgery. Sometimes things aren't clear beforehand, or as the years go by, people get busy, and it's easy to forget some of the principles of bariatric surgery. And so patients often have a lot of questions, sometimes even years after surgery, and we at Bari Life thought we would try to help address some of these. So I have a list of several questions that I thought I'd go through for today. The first one says, I have been regaining weight 5 years after my gastric sleeve, and it seems like I can eat way more than I used to. Can I get a redo or adjustment of my gastric sleeve, or should I just get the duodenal switch? That's a great question, and the answer really depends on what all is happening. If it is simply for weight regain, as the question implies, and the patient is not having any other problems with their sleeve, then I would probably recommend conversion to the duodenal switch as the safest, most effective revision to provide significant weight loss. There are complications with trying to re-sleeve the stomach that I think are prohibitive, and basically that means the leak rate from the staple line is really high. The next question says, my weight has fluctuated between 171 and 186 pounds. I can never maintain at a specific weight. How can I stay at one specific weight? Well, I think if your weight is only fluctuating 5 pounds, I think that's normal. I like to say that we are all either up 5 or down 5, and that type of weight fluctuation is normal. So congratulations on your successful weight loss. The next question says, how do you lose weight while on steroids? I have been on prednisone since March. I keep losing and regaining the same 5 pounds. I am constantly hungry. I try to keep on plan, but hunger trips me up. I exercise and walk. It is true that steroids are associated with weight gain, and clearly you're doing a good job since you've only gained 5 pounds. A lot of the weight people gain on steroids is water weight, but it also induces fat intake and fat gain. So hopefully your medical condition will allow you to get off the steroids as soon as possible, but the only thing you can do is do what you've been doing and watch your macros and try to stay active. Next question is, how do I know when I've reached a good goal weight after gastric bypass surgery? Personally, my goal for my patients is to attain a body mass index of 28 or less. Sometimes that may or may not be feasible depending on where the BMI was when you started. But my goal for my patients is a BMI of 28 or less, which gets them out of obesity. Technically, they're still medically overweight, but there's really no negative health implications to being medically overweight. The next question, post-op, after the pandemic, I gained 50 pounds. It is so hard to lose it. I did a sleeve gastrectomy on this patient in 2014. The patient asks, would bypass be an option? The patient says they have several connective tissue disorders and would love to lose the weight again. What suggestions do I have for them? They need to lose 70 pounds. I think after the pandemic, and a lot of people have gained weight, they've been more sedentary. They had a sleeve gastrectomy, and just like the patient before, you can convert to a gastric bypass, but I typically only convert a sleeve to a gastric bypass if the patient is having medically refractory reflux. If the issue is weight regain and they need to lose 70 pounds, again, I would suggest considering conversion to a duodenal switch.
Why is that what you would recommend?
Conversion to the duodenal switch is superior to conversion to the gastric bypass because if you convert a sleeve to a gastric bypass, patients will usually lose about 40% of their excess weight. Whereas conversion to a duodenal switch often affords 70% excess weight loss with a much lower risk of weight regain. If you convert to a gastric bypass, they still have a 30% risk of weight regain, whereas conversion to a duodenal switch, the risk of weight regain is less than 5%. The next question says, hey, I'm 13 years status post Roux-en-Y gastric bypass and lost 90 pounds the first year. Since menopause hit, I've gained back 30 pounds in the last few years. I've been told my bypass doesn't work anymore for weight loss. I'm kind of devastated because my whole insides have been rerouted and dependent on vitamins the rest of my life. So what can help me? I'm 59 years old with arthritis. Thanks. The gastric bypass will still work, but it's not like it's going to be the first year. The first year after surgery, patients have a strong sense of restriction, that is, they can't eat very much. But that feeling naturally goes away, and it needs to. We can't survive if we can only eat one bite of food at breakfast, lunch, and dinner. The way to get back on track is to consider doing a pouch reset and remember and refresh your ability to be able to read nutrition labels expertly and really watch your macros. The successful patients after gastric bypass will stay on a high protein, low carb, low fat diet. In my practice, I like to recommend no more than 30 to 60 grams of carbs a day and less than 30 grams of fat a day. And depending on how tall the patient is, anywhere from 60 to 120 grams of protein a day. When you're going to eat dinner and you're going to have your chicken breast and your summer squash and your fresh fruit, eat all of your chicken breast first. Fill up on the protein. After that, you can have as much summer squash and fresh fruit as you want. That's obviously just an example of a meal, but that's the proper way to eat after gastric bypass in order to maintain your weight loss. The next question says, I had sleeve gastrectomy last November 2020. I was around 400 pounds. I am 6'2". I lost 20 pounds before surgery. Since then, I have reached a weight of 330 pounds. Then my weight loss stopped. I would like to lose another 50 pounds. Do you know if I can do it, or is my weight just stabilizing around 300 pounds? In total, this patient has lost 90 pounds. With a sleeve gastrectomy, I would have expected them to probably lose around 95 pounds, about half of their excess weight, which is what they've done. So this patient has been a very successful sleeve gastrectomy patient. It is not impossible to lose another 50 pounds, but by doing so, it will take being more compliant with the diet and probably exercising more often than the average patient does. I think this patient has had an excellent weight loss, and if they are unable to lose another 50 pounds and they really medically need to, they may want to consider conversion to a duodenal switch. Next question says, post-op, I have gained back about 40 pounds and I want it off. Is there a procedure to make my pouch smaller? I had a Roux-en-Y gastric bypass 12 years ago. I have made big changes to my diet now, but not much success losing this weight. It is normal for the gastric bypass patient after the first year to be able to eat more food. And most patients who feel that their pouch has stretched out, it's actually normal 80% of the time. So it's really pretty rare for the gastric bypass pouch to expand, but it's normal for the gastric bypass patients to be able to accommodate more food. This is especially going to be true with soft, high-carb foods. So again, in order to try to lose that 40 pounds, it's going to take a combination of getting back on an appropriate gastric bypass diet So I would recommend getting back with your bariatric dietitian to help you with this, and then also stepping up your activities and calorie burn each week. The combination of those two, I think, could help you get back on track and lose the 40 pounds that you've regained. Post-surgery, two-part question. Is it true that the stomach stretches out after sleeve gastrectomy? And what is the key to maintaining your goal weight years after sleeve surgery? It is true that the sleeve will naturally dilate during the first year after surgery. Most surgeons try to make the sleeve at the time of surgery so that it will have a capacity of about 2 to 3 ounces. If you measure the sleeve a year later, they'll usually have a capacity of 5 or 6 ounces, and it usually stabilizes out at about that size. But patients will also naturally be able to learn how to accommodate more food, not only because the sleeve is dilated, but because the bowel just does that, just like it does after a gastric bypass. So the key to maintaining your goal weight years after surgery is mastering the postoperative bariatric diet the first year when you don't feel hungry and you feel very restricted. It's very important to take advantage of that first year. It's like your honeymoon. And if you can learn how to master that way of eating and then stick to it, you will keep your weight off long term, years after year after sleeve gastrectomy. Next question says, I had surgery in 2013 and I've done well. I'm now 65, starting on Medicare. Over time, my loose skin over my lower abdomen seems to have gotten looser and more bothersome. Is it common for this area to become worse over time, even after the weight loss has stopped? Does insurance pay for removal? There is some natural slackening of the skin as we age. Even if your weight stays the same, your body composition likely is not staying the same. You probably are losing muscle and gaining some fat. That just naturally happens as we age. Additionally, our skin's elasticity decreases as we age. So even though your weight is staying the same as you age, you may expect to have some extra loosening of the skin, and the lower abdomen is a common place for this to happen. Medicare does cover some simple procedures. The difficulty is that most plastic surgeons do not participate with insurance, so they're not bound to the fee schedules that the insurance companies have. Next question says, what types of surgery do you perform after weight loss to help with loose skin? How long after weight loss surgery should you wait to have this done? There are many types of skin reduction surgery that can be done depending on the body area affected. You can have a brachioplasty for your arms, you can have a medial thigh lift for the legs, you can have a paniculectomy or a abdominoplasty or a corset trunkplasty for the truncal area. So it really depends on what's going on with that individual patient. I would generally recommend being patient though. I advise patients to wait a couple of years after their weight has stabilized. So once you're done losing weight, try to just live with it for a while and give your skin a chance. Certainly younger people who don't smoke and who stay out of the sun and don't abuse their skin have significant elasticity, and your skin can remodel itself significantly over time. So be a little patient, live with it, and if in the end you have areas that really bother you, you should consult your physician. Next question says, after having bariatric surgery and when counting total carbs for a day, are you supposed to count every carb that comes in, all you consume for the day? For example, bariatric calcium chews, crystal light sweetener, etc. And in general, yes, you should try to include all of your carbs when counting macros. You don't have to count your macros every day. If you're taking the same supplements every day, You can kind of count them up once, and if you know they contain 15 grams of carbs, you can just factor that into your daily macros. The next question says, do I have to take vitamins? What kind and for how long after surgery? Our medical societies, the American Society of Metabolic and Bariatric Surgeons, has made formal recommendations about what patients need to take in the form of vitamin and mineral supplementation after surgery. It varies a little bit between the sleeve, the gastric bypass, and the duodenal switch. So what vitamins and minerals you need to take will depend on the procedure you had, but you should take them for the rest of your life because your GI tract will always be arranged that way. The next question says, thank you in advance for your reply, Dr. Boyce. I had SADS on the 10th of May, 2021. I have been taking my Just One multivitamin with iron on a daily basis. I take this in the morning before food, usually with coffee. My question is, given that due to the loop we don't digest foods as well, would it be more effective to take the pill at night to maximize the chance of slower digestive process, therefore to increase the chance of absorbing as much of the vitamin as possible? I don't have any data to suggest that taking the vitamins at night versus day improves absorption. It is true that duodenal switch patients and the variants of the duodenal switch, like the SADS, have impaired absorption. I would comment that the Just One multivitamin was really designed for the sleeve and the gastric bypass patients, and duodenal switch patients and variants of duodenal switch need to take 1.5 tablets of the Just One vitamin to meet the current recommendations. The next question says, what has changed since my surgery date, September 28, 2005, as far as daily supplements required or recommended to avoid deficiencies, of which I have several? I don't seem to be absorbing much orally. A lot has changed. Physicians, surgeons did not have any recommendations to go by from our medical societies or any other authoritative source until 2008. 2008 was when the ASMBS came out with their formal nutritional guidelines as far as what patients were to supplement with after surgery. So, in 2005, you may well have been told just to take 2 Flintstone vitamins a day, which is not going to come close to meeting the current recommendations. There are clear guidelines now that were originally established in 2008 and modified in 2013. Certainly you could feel free to contact Bari Life, and we would be able to happy to provide you with some resources regarding what the current recommendations are.
And there were updated versions in 2016.
I think that was a Allied
Health.
Health guideline, not necessarily from the ASMBS, but still, yes. Yeah.
They're out there.
Yes.
The guidelines.
The guidelines are out there. Next question says, what should one add to the Complete Bariatric Vitamin Tablets to cover prenatal needs? Can you take a regular prenatal vitamin at the same time as the tablets? I like this question because we want to be clear that when a lady becomes pregnant, she should stop her bariatric vitamins, probably begin a general prenatal vitamin, and consult with her obstetrician. If the bariatric vitamins are following the guidelines, they are likely to have too much vitamin A for a developing baby. So you do not want to take a bariatric formula during pregnancy. You want to use a prenatal formula, but always consult with your obstetrician. My next question says, after your stomach has healed after gastric bypass, like 2 to 3 months, if a person started smoking, would she develop adhesions or problems from smoking cigarettes? The answer is yes. The gastric bypass is very intolerant to cigarette smoking, and it doesn't matter if it's 2 months or 20 years after gastric bypass. If you start smoking, you are running the risk of developing marginal ulcers, which can bleed, stricture, and perforate. After gastric bypass, you must not smoke anything. Next question. I have severe pain on my left side. Nothing shows up on x-rays taken. Would a hernia show on x-ray? A hernia would likely not show on a regular x-ray, and it depends on what type of hernia you're referring to. But if you had any type of bypass, that is gastric bypass or duodenal switch, you could be at risk for an internal hernia, which you cannot feel from the outside, but can be very serious and dangerous. These often present with left-sided abdominal pain, and I would recommend you consult with your physician. Next question. I had a BPD-DS May 2009, and I'm wondering if my body will adapt and change the absorption rate. The answer is yes, it does. The bowel does adapt after duodenal switch, but there's no real clear data on exactly what that means. Although one thing that has been shown is that after years after duodenal switch, the bowel can adapt to the point where the colon actually begins to absorb protein from the food you eat, which is not a normal condition for the colon. The next question says, I have a question about pain management. I'm sick.
Real quickly, do you think that they may have been asking about calories? I mean, like otherwise?
I don't know. I thought they were probably talking about vitamins and minerals.
Yeah. I was just thinking, like, if they're thinking, am I going to be able to start absorbing more calories later? Like, is it become more efficient at absorbing calories or something like that?
So we know that the colon can adapt to absorb more protein.
So it'll be absorbing the calories from protein in that instance.
But we also know that the long-term risk of regaining weight after the duodenal switch is less than 5%, and that doesn't change over time. I don't know if there's any data, I haven't seen any, about the improved absorption of vitamins and minerals after duodenal switch over time. The next question is, I have a question about pain management. I'm 65, I have a chronic joint pain in my legs, hips, and knees. I only take Tylenol at this time. Are there any anti-inflammatory medicines that I can take? Thank you. Patients who have a sleeve gastrectomy or a duodenal switch are able to take anti-inflammatory medications without an increased risk of ulcers. Anyone who takes anti-inflammatory medications is accepting a certain level of risk of gastritis and ulcerations. After gastric bypass, however, the risk of ulceration is greatly increased with non-steroidal anti-inflammatory medications. So we advise gastric bypass patients not to take anti-inflammatories. Tylenol is recommended. After sleeve gastrectomy and duodenal switch, since the risk is not increased, those patients are able to take non-steroidal anti-inflammatory drugs with a low risk of ulcerations and gastritis.
So ibuprofen.
Yeah, examples of your non-steroidal anti-inflammatory drugs are ibuprofen, Aleve, Goody's powders, Excedrin. You just can't take those things after gastric bypass. Next question. After Roux-en-Y surgery, my iron has dropped. My hematologist suggests it was caused because the surgery bypasses the area where iron is made. Could that be? I have had several iron infusions. It is true that the gastric bypass bypasses the portion of the bowel where iron is absorbed. It's not technically made there, but it is absorbed there. And patients' ability to absorb iron after gastric bypass, sleeve, and duodenal switch is cut in half. So if a patient has iron deficiency, it's not uncommon for that to become iron deficiency anemia after surgery, which would require treatment. One treatment is iron infusions. Of course, we usually try to supplement with oral iron first, But if a patient is unable to adequately treat their iron deficiency anemia with oral iron tablets, then they may have to have periodic iron infusions. Next question is, I had my BPD surgery in 2012. I've been having some stomach issues. Someone told me to drink 2 ounces of aloe vera juice every morning and it would help with stomach issues. I want your advice on this matter. Well, I do not know anything about what is actually in aloe vera juice. If you're having stomach issues, I would surely recommend that you consult with your bariatric surgeon. The next question says, is revision surgery an option for gastric sleeve patients who have severe gastroesophageal reflux disease? I'm 2.5 years post-sleeve. Dr. Boyce was my surgeon. There are options. There are 2 different procedures that I have done for patients after sleeve gastrectomy if their reflux is not able to be controlled with medications. And there are multiple medications that we can try to control it, and we should always try medical aspects first. However, some patients are on 3 different medicines 4 times a day and they're miserable with their reflux. The 2 procedures that have been effective are either conversion to a gastric bypass or performing a drainage procedure on the stomach called a pyloroplasty. The idea with a pyloroplasty is that it helps the stomach drain. If you can keep the stomach empty, then there's nothing in there to reflux. The next question is, what procedures are available for post-sleeve gastrectomy when weight regain occurs? The first recommendation, of course, would be to get back with your bariatric dietitian, keep a honest food journal, and try to get back on track and lose the weight with proper healthy diet and reasonable amounts of activity. If this is not an option, or if the patient had a very high BMI and even though they were successful with sleeve, they still have weight to lose, then options depending on other factors such as reflux, abnormalities of the sleeve, options would include conversion to a gastric bypass or conversion to a duodenal switch. But when you start talking about revision and conversion surgery, it can get very complicated and very individualized. So that's just a general answer. Next question is, hello, I'm 5 weeks post-sleeve. My question is, I can never get answers on taking medication. Is it okay to swallow pills? Should I avoid extended release medication? Can I take allergy medication? Please help. In my practice, I allow patients to take their tablets, medications, vitamins, for example, after 4 weeks after sleeve gastrectomy. So taking medication is okay. Even extended release medications are okay after sleeve gastrectomy because with the sleeve gastrectomy, there is no bowel bypass, that is, small intestinal bypass. The small intestine is where your medications are absorbed. So really the only operation that requires avoiding extended release medications would be the duodenal switch. Allergy medicines are well tolerated after sleeve gastrectomy.
Not the gastric bypass.
And the gastric bypass, all of them, yes. Allergy medications are well tolerated after any of the bariatric operations.
But you'd want to avoid extended release after gastric bypass as well. Why not?
Even after gastric bypass, extended release medications are very effective because the amount of small bowel that's bypassed is very short. With a gastric bypass, only about 10 to 15% of the small intestine is bypassed. That's why patients who have gastric bypass absorb calories from the food they eat normally. There's no calorie malabsorption with the gastric bypass, specifically with protein, and carbs. And carbs are the reason for weight regain. So calorie absorption you should consider to be normal after gastric bypass, and medication absorption is normal after gastric bypass. Does that make sense?
Yeah, it's just contrary to what I thought.
Yeah.
I thought gastric bypass had calorie malabsorption.
Everybody does, but they don't. And that's why 30% of those patients gain their weight back just like a sleeve gastrectomy.
Huh.
And that's what I tell them during my initial consultation.
Hmm.
The next question says, I am 10 months out from gastric sleeve. Within the past month, I've developed an aversion to meat. Beef, chicken, turkey, pork. All make me nauseated and sometimes I vomit. I'm eating small bites, 3 to 4 ounce portions, taking my time, grilling or baking, still can't stomach it. Is this typical? And what other than protein shakes would you recommend to get my protein in? Thank you. This is not typical. You should be able to tolerate 3 to 4 ounce portions of those meats. I agree with grilling and baking, certainly. I would recommend that you get back to your bariatric surgeon and have your sleeve evaluated. You may have a hiatal hernia. There could be some kinking in your sleeve. There could be a narrowing in the mid portion of your sleeve that's making it unable for you to eat food. In the meantime, in order to get your protein, you would probably tolerate low-fat cottage cheese and Greek yogurt and other very soft, very moist protein sources. You could also check out for protein-fortified soups if you're tired of the sweet protein shakes.